Good day everyone, I am Jevan A. Sherva, Bethel 3 student. So today, I'm going to discuss the gastrointestinal diseases and disorders. So what is gastrointestinal diseases and disorders? Well, it can occur in all ages of swine. Most digestive diseases are referable to the gastrointestinal tract and result in diarrhea and occasional vomiting. Diarrhea is the result of an intestinal dysfunction caused by malabsorption, excessive secretion, or effusion. Unfortunately, this is not an exclusive characterization of diarrhea and overlap occurs. Rather, differential for diarrhea should be referable to age and onset and site of infection. So as we can see in the table 2, these are the common gastrointestinal diseases and disorders of pigs. So the first column provides the diseases. The remaining columns represent the respective phases of production. The frequency of the occurrence is occasional, common, and routine. So as we can see in a gastric ulcer, in a pre-weaning is nothing, but in a post-weaning nursery is occasional, and post-weaning growth finish is a routine, and immature is a common. So in a Clostridium difficile, in pre-weaning is a routine, but nothing in post-weaning nursery, post-weaning growth finish, and immature. Next is a Clostridium perfringens type A or the CPA. It is a routine in a pre-weaning but nothing in post-weaning nursery, post-weaning growth finish, and immature. So next is a Clostridium perfringens type C or the CPC. It is a routine in pre-weaning but nothing in post-weaning nursery, post-weaning growth finish, and immature. So next is the coccidiosis. There is a common in pre-weaning, so common in post-weaning nursery and nothing in post-weaning growth finish and immature. So next is the salmonellosis. Common in pre-weaning, common in post-weaning nursery, nothing in post-weaning growth finish, and also in a mature. So next is the swine dysentery. Nothing in pre-weaning, nothing also in post-weaning, but it is a routine in post-weaning growth finish and common in a mature. So next is the porcine proliferative enteropathy or the PPE. Nothing in pre-weaning and also in a post-weaning nursery, but a routine of post-weaning growth finish and occasional in mature. So next is the rotavirus. In a rotavirus, in a pre-weaning, it is a routine, and post-weaning is a common, and in a post-weaning is nothing, but in a mature is a common. So next is a transmissible gastroenteritis or the TGA. It is a routine in pre-weaning, common in post-weaning nursery, common also in a post-weaning and also in a mature. So next is the porcine epidemic diarrhea or the PED. Routine in a pre-weaning, occasional in post-weaning nursery, post-weaning growth finish is a common and also common in a mature. Lastly is the whipworm. Nothing in a pre-weaning, also nothing in a post-weaning nursery, but routine in post-weaning growth finish and occasional in a mature. So now let's move on to the diseases and disorders of the pigs. So first is the gastric ulcers. It is a non-infectious and results when glandular mucosis, specifically the pars esophageal, is traumatized by gastric acid. Gastric ulcers have a wide variety of causes but are most commonly associated with a small feed particle size and interruption of feed intake, whether caused by disease or poor management. It is common to see an sign consistent with gastric ulceration increase following an acute PRRS or influenza outbreak. Morbidity and mortality vary with the scope of the underlying causes. Next is the rotavirus. It's a non-enveloped RNA virus with a double-layer capsid, allowing it to remain stable and effective in the environment for months and intrinsically resistant resistant to some disinfectant. For surge of infect swine A, B, C, and E. In addition, infection with a particular C groups vary by age. Type C mostly in suckling piglets and type A predominantly in nursery pigs, and type E is the most prevalent C group. This virus infects and destroys vellus enterocytes, resulting in vellus atrophy. In response, creep cells fill in the gaps, but because they are incapable of absorption, suckling piglets quickly lose body condition and have a gaunt or waste appearance. So for the treatment, it is supportive by administration of oral rehydration solution. Next is the transmissible gastroenteritis or TGE. TGE is caused by TGF, a coronavirus that is heat level at a temperatures above 21 degrees Celsius, prone to desiccation and photosynthesization. The epidemic form causes acute diseases in all age groups within a little as 18 hours of infection. Morbidity and mortality is high, approaching 100% in an episodic outbreak. The severity of diseases is age dependent, but all ages will develop diarrhea. Post-winning infection result in a high morbidity but low mortality. The most significant economic losses at this time are caused by reduced average daily gain, market weight, and overall system efficiency. The absence of seroconversion indicates successful elimination of TGF. Commercial vaccines are available but should be used with caution and only when elimination is not an option. So next is the porcine epidemic diarrhea or the PED. Porcine epidemic diarrhea is caused by PEDIV, a coronavirus that causes signs and histopathologic lesion indistinguishable from TGE virus. Unlike TGE virus, PEDV virus is more environmentally resistant, making elimination more difficult. The disease has been described in Europe, Asia, and as of 2013. So the prevalence of enzootic form is approximately 50%, and the morbidity approaches is 100%, and mortality is 80% or more in a sows herd, resulting in 3 to 5 weeks of production losses. Clinical signs is appears with 12 hours. Piglets develop a watery, fetid diarrhea leading a dehydration, metabolic acidosis, and death before caretakers are able to humanly euthanize them. So next is the porcine coccidiosis. It is the most often caused by Isophora soris. Farm hygiene, specifically farrowing rooms and sows infestation, influence the persistence of disease. However, age at infection rather than infectious dose has the greatest impact on severity. The prepatent period is approximately 5 days. Morbidity is variable and mortality is low. Pasty diarrhea and thrifty to pot-bellied appearance of say 7 to 21-day-old pigs and below average when weight is suspicious for coccidiosis. So for the prevention of this it is by oral administration of an anticoccidial of fluorine may reduce environment contamination. So next is the swine dysentery. It is a spirochete of the genus Brachyspira that is an oxygen tolerant in a rube, giving it in the ability to survive for a long period of time in a manure, pits, and lagons. Rodents, particularly mice, are known vectors and can serve as the reservoir. Brachyspira hydrocenteria is the species known for causing swine dysentery. Other species of Brachyspira have been recently described in dysentery-like disease, Incubation is 10 to 14 days, but disease occurs in a 3 to 4 weeks cycle. So, to control and prevention of SD is by passively derived lactogenic immunoglobulins from vaccinated females. Prevention of PWD includes selection of genetically resistant breeds lacking K88 and F18 receptors, administration of an oral virulent leaf culture to stimulate active immunity or comfortably exclude failed strains, feeding 2,500 ppm zinc oxide post-weaning and the probiotics. Immunity and exclusion is unique to each febria. Vaccines should be include the prevalent genotype causing the diarrhea. So next is the Clostridium perfringens type A or the CPA. It is a gram-positive bacillus and inefficient sporulator. Sows are regarded as the source of neonatal infection. The frequency of CPA diarrhea is on the rise in the USA. And in uncomplicated cases, mortality is low whereas the morbidity is high and below average weaning weight results. So for the treatment has a variable success rates and is limited to administration of empirically selected antibiotics and oral rehydration solution to affected piglets. Control of CPA enteritis is best accomplished by preventing other causes of S. So the following are through cleaning, sporicidal disinfectant should be applied to farrowing crates and equipment between litters and be allowed to dry before reloading. Feeding of bacitracin to sows has resulted in significant increase in weaning weight. Next is the Clostridium difficile. It is a gram-positive bacillus that is easily sporulate, making it environmentally resistant to many disinfectants. Clostridium difficile, it is associated diarrhea leads to a 10 to 15% reduction in wean weight. Although more than a third of piglets, diarrhea involves Clostridium difficile. It is the better known to cause healthcare-associated infection among humans. The pathogenesis of Clostridium difficile infection is in response to the expression of toxins A and B. A watery diarrhea occurs in 1 to 7-day-old piglets. Clostridium difficile is a difficult to culture and can be isolated from healthy piglets. Therefore, volcanolotion on histologic exam and confirmation of toxins in fecal contents by antigen ELISA are diagnostics. So, for the treatment, it is ill-defined but is likely similar to that for CPA enteritis because it is likely to be initiated based on clinical signs, which are similar. Autogenous vaccines are used to aid in prevention, but efficacy is unclear. Next is the person proliferative enteropathy or the PPE. So PPE is commonly referred to as ileitis. It is a general categorization of infections caused by Lawsonia intracellularis, an obligate intracellular bacterium because the bacteria cause lesions in the ileum. PPE is also referred to as ileitis. PPE can further be divided into 4 clinical forms. First is the porcine intestinal adenomatosis or the PIA. It is the most common in 6 to 20 weeks pigs and causes lethal mortality. Porcine hemorrhagic enteritis. It is the affecting pigs to 28 weeks of age and older, including breeding swine, and can be associated with increased mortality and dark, bloody stools. Next is the necrotic enteritis or the NE. The subclinical ileitis, the most common form, occur among post-weaning pigs. In all forms, transmission is by the fecal-oral route. So, when diarrhea ranging in color from normal PIA in E and subclinical to dark red or black PHE is observed, PPE should be considered as a possible cause. So for the treatment, it is with effective antibiotics such as tylosin administered by injection or in the feed or water. Control is by administration of a commercially available modified live oral vaccine before infection or feeding antibiotics when infection is known to occur. Vaccination should take place at least 8 weeks before seroconversion. Next is the salmonellosis. It is a causing gastrointestinal disease in a swine. It is most commonly associated with the species Typhimurium. Salmonella typhimurium is the commonly isolated from swine. Isolation of multi-drug resistant strains of salmonellosis. Typhimurium from swine at slaughter have garnered attention from public health and food safety professionals, and it is this that make this infection significant to the pork industry. Some European Union member states have implemented meat juice serologic monitoring at slaughter to assess on-farm salmonella control programs. So for the treatment, it is with antibiotics administered symptomatically to diarrhea of pigs. Antibiotic susceptibility of the isolate should be considered before initiating treatment. Rearing pigs on a slat floor, decreasing stocking density, and the accidentification of digesta are effective in reducing the prevalence of salmonella infection in swine. Cross-protection with salmonellosis chlorosis vaccine has been reported to and reduces carcass clonalization. Lastly is the whipworm. Whipworm infestations of swines are the result of Trichorest suis infection. Pigs kept on pasture in outdoor lots or facilities with history of Trichorest suis. Diagnostics are at a greatest risk of diseases. The repeated period is 6 to 7 weeks. The eggs is not immediately infective, which requires 3 to 4 weeks in the environment. The infectious larva hatches from the egg and invades endocrisitis in the small intestines and second. The entire life cycle of Trichoresus suis is completed in the intestine. So for the treatment and control are synonymous and required administration of an effective anthelmintic like fenbendazole. Prevention is by stem sanitation and drying. However, eggs are resistant to common disinfectant and remain infected for years. So that's all my report. Thank you guys for listening. God bless.